Greetings, my name is Saveo Edwards, and I'm a registered dental hygienist and a second-year dental student at Meharry Medical College School of Dentistry. Throughout my years as a healthcare provider in the dental field, I have seen how prevalent diabetes is within the Black community. The American Diabetes Association states that the prevalence of diabetes is 11.7% for non-Hispanic Blacks, and that 60% of African Americans are more likely to be diagnosed with diabetes in the United States. I've been able to experience this firsthand as a hygienist because of the strong connection between diabetes and periodontal disease. Uncontrolled diabetes will lead to higher blood sugar or glucose levels in their salivary fluids. African Americans have the highest prevalence of periodontitis at 11.4%. The infections from untreated periodontal diseases can cause blood sugar to rise and make it harder for those patients that have diabetes to get it under control. As a hygienist and student doctor, I will continue to educate and manifest the proper techniques for prevention of periodontal disease and gingivitis, which is brushing twice a day, flossing twice a day, and toothbrushing techniques, and adequately addressing how this connection of prevention for oral health will help improve the patient's diagnosis of diabetes and their oral health diagnosis. Most patients I have seen with both diseases have uncontrolled body mass index. So I will also conduct nutritional counseling and explore goals and exercise to diabetic patients. I think these two are the pinnacle of reversing the diagnosis of diabetes that will not only improve and develop the patient's oral health, but the whole body. As health practitioners, we should be leaders to serve the people. It is important for us not to prescribe medicine to suppress or cope what can be a life-threatening result and have more empathy to the Black community's health. We must listen to their challenges with diabetes and speak or teach for growth and development. Pushing an aggressive diet and cultural change should be the primary answer to diabetes treatment. I think it is important to present to people the bigger picture and empower them with education to heal them. There are sometimes some inconsistencies in handling of diabetic care, with some patients being presented with diet and lifestyle changes and some patients being given medications. We must change this because our success as practitioners comes from their success as patients. As a hygienist and student doctor, I will continue to have this type of approach with diabetic patients in the clinic, at school, and as a hygienist. This is the way I and other health practitioners can develop the patient's oral health and total body health to the highest potential.